To create the most useful and effective diagnostic imaging, it's important that veterinary teams keep patients still, safe, and comfortable during advanced imaging procedures like X-rays, ultrasound, CT, and MRI. Sedation calms a pet, reducing movement and stress while keeping them responsive. Anesthesia causes complete unconsciousness and lack of sensation. Choosing between sedation and anesthesia depends on the imaging modality, patient factors, and diagnostic goals. Sedation typically uses agents like dexmedetomidine or butorphanol. Anesthesia often involves induction with agents like propofol and maintenance with inhalant anesthetics like isoflurane or sevoflurane. In order to produce clear, diagnostic-quality images, patients must remain completely still, sometimes for several minutes. Absolute stillness is critical to minimize unintended distortion artifacts. The most common cause of artifacts is patient movement, often requiring repeat exposures. Even tiny movements from breathing or muscle tension can blur the image or obscure disease. For MRI and CT, breath holding or controlled ventilation is often required. In the case of basic X-ray producing machines, sedation is also used to reduce radiation exposure to staff by minimizing physical restraint. MRI requires general anesthesia for all patients. Noise, magnetic field safety, and prolonged scan time demand absolute stillness. Most patients also need anesthesia for CT imaging, especially for contrast studies, abdominal, and thoracic scans. In some rare cases, sedation may be used for quick scans, including head or extremity imaging. Ultrasound is generally less complicated. Many abdominal or thoracic exams can be done with just light sedation. However, deep sedation or anesthesia may be used for biopsies when absolute stillness is required for patient safety. In radiography, light sedation should be used to reduce stress, prevent staph exposure, and position animals safely. For both sedation and anesthesia, a catheter is placed in a vein, usually in the forelimb. Sedatives may be given as a single injection or as a continuous infusion. Anesthetized patients are typically intubated with an endotracheal tube and connected to a gas anesthesia system. Inhalant anesthesia allows for rapid adjustment of depth and is essential for long or high-stakes studies. Drugs are selected on patient health, procedure duration, and species differences. Patient safety is the top priority. Vital signs are continuously monitored depending on the diagnostic exam type and can include heart rate and rhythm via ECG, oxygen saturation SpO2 and respiratory rate, end-tidal CO2, especially for patients on ventilators, blood pressure, and body temperature. For MRI and CT, ventilators may be used to pause breathing during scans for perfect image alignment. And anesthetic records are kept throughout the entire procedure, documenting every vital sign and intervention at fixed and consistent intervals. While sedation and anesthesia are generally safe, all medications carry risk. Older pets, those with heart or kidney disease, or certain brachycephalic breeds may need tailored protocols. Therefore, pre-anesthetic blood work, tailored drug selection, and ASA classification are critical. The American Society of Anesthesiologists scale helps clinicians assess patient risk prior to anesthesia. Complications are rare, but can include hypotension, hypoventilation, or delayed recovery. Each patient can have unique considerations. Short-nosed breeds like bulldogs may have compromised airways. Geriatric pets may have reduced organ reserve. And patients with liver, kidney, or endocrine diseases require careful drug selection and monitoring. For example, Cushing's disease may alter the metabolism of sedatives, potentially making hyperthyroid animals more sensitive to anesthetics. At Sage Veterinary Imaging, sedation and anesthesia are overseen by board-certified veterinary anesthesiologists, ensuring the highest standards of patient safety. Each protocol is carefully tailored to the individual patient, accounting for breed, underlying disease, and specific risk factors to minimize complications and maximize safety throughout the imaging procedure. After imaging, pets recover in a warm, quiet space under constant supervision until their temperature and vitals show they are stable. When released to go home, recovery can take a few hours to several days before normal energy returns. It's normal for patients to experience drowsiness, unsteady walking, slower responses, and decreased appetite while recovering. Recovery time varies based on agent choice, procedure time, and pre-existing conditions. If you notice difficulty breathing, repeated vomiting, pale gums, excessive pain or swelling, or collapse, bring this to the attention of a veterinarian as soon as possible. Sedation and anesthesia enable diagnostic clarity in modern veterinary imaging while keeping pets comfortable and still. With the right protocol, monitoring, and training, the risks are minimal and the benefits are immense. Effective imaging promotes clear diagnosis, informs effective treatment plans, and gives pets the best chance for positive outcomes.